Major corporations are using the COVID crisis to push cash-strapped governments into outsourcing and privatizing our public services. But privatization has actually made the problem a whole lot worse. An analysis of COVID cases found that countries which privatized their healthcare systems reduced their long-term preparedness for dealing with pandemics. In Australia's COVID-hit private aged care sector, residents are entitled to just 3.5 metres of communal space. That's less than half the amount recommended for free-range hens. It's no wonder almost 1 in 3 of the sector's personal care workers have now tested positive for coronavirus. While public service users and workers pay the price, private corporations are making huge pandemic profits. Like in the UK, where the government outsourced its track and trace program for £45 million to Serco. As in, covered up the sexual abuse of immigrants in detention, Serco. As in, admitted to fraud and profiting unlawfully from the taxpayer, Serco. As in, presented false data to the British National Health System on 252 occasions. Yeah, that's Serco. A leaked email shows Serco's very own chief executive doubted their track and trace scheme would evolve smoothly, but wanted to cement the position of the private sector. Let's be clear, privatization is part of the problem, not the cure. But to stop corporations from shaping the recovery in their interests, we need an alternative. Remunicipalization. It's simple. We fix the failures of fragmented private services by bringing them back into public hands. Public Services International has created a remunicipalization guide which gives unionists and activists the arguments, strategies, and policies needed to win our public services back. Over 50 case studies from around the world show that beating the privatization agenda is possible.